Hello guys, I am Tejas Tate from second year pursuing MBBS in Dr. Ullas Patil Medical College. Today's my topic is adrenergic system. The nervous system is divided into central nervous system and peripheral nervous system. Peripheral nervous system is again divided into afferent division and efferent division. Efferent division is divided into somatic system and autonomic nervous system. Autonomic nervous system has three parts: system sympathetic, parasympathetic, and enteric nervous system. We can see the summary of neurotransmitter released. In the preganglionic neuron, acetylcholine is formed and it is released and it binds to the neuroeffector transmitter on its neurogenic receptors. Adrenergic system, adrenergic transmission. Noradrenaline, it is transmitter at postganglionic sympathetic sites. Adrenaline, it is secreted by adrenal medulla and may have transmitter role in the brain. Dopamine, it is a major transmitter in basal ganglia, limbic system, anterior pituitary, etc. Steps in the synthesis of catecholamines. First step is the synthesis of catecholamine. Second step is storage of catecholamines. Third step is release of catecholamines. Fourth step is uptake of catecholamine. And fifth step is metabolism of catecholamines. So first step is synthesis. Catecholamines are synthesized from the amino acid phenylalanine. Tyrosine hydroxylase is specific and rate limiting enzyme. Synthesis of noradrenaline occurs in all adreneric neurons, while that of adrenaline occurs only in the adrenal medullary cells. Storage of catecholamines. Noradrenaline is stored in the sympathetic vesicles or granules within the adreneric nerve terminal. The vesicular membrane actively takes up the dopamine from the cytoplasm, and the final step of synthesis of noradrenaline takes place inside the vesicle, which contain dopamine beta hydroxylase. Noradrenaline is stored as a complex with ATP in the ratio 4:1, which is absorbed on a protein chromogranin. Uptake of catecholamines. Axonal uptake. An active amine pump is present at the neuronal membrane, which transports noradrenaline by a sodium coupled mechanism. It takes up noradrenaline at a higher rate than adrenaline and had been labeled uptake 1. Vesicular uptake. The membrane of intracellular vesicle has another amine pump, the vesicular monoamine transporter, which transports catecholamine from the cytoplasm to the interior of the storage vesicle. This uptake is inhibited by reserpine, resulting in the depletion of catecholamines. Extraneuronal uptake. It also called as uptake 2 and carried out by extraneural amine transporter. Characteristics of subtypes of adrenergic receptors. Adrenergic receptors are alpha 1 and alpha 2. They are present in the tissues in smooth muscles, liver, intestinal smooth muscles, heart. Their function or response is contraction, glycogenolysis, gluconeogenesis, hyperpolarization and relaxation, increased contractile force, and arrhythmias. Alpha 2 receptor is present in pancreatic islets, platelets, and vascular smooth muscle. Their function is decreased insulin secretion, aggression, and contraction. Beta receptors are beta 1, beta 2, beta 3. Beta 1 is present in juxtaglomerular cells, nerve terminals, and heart. Their response is increased renin secretion, decreased release of norepinephrine, increased force and rate of contraction, and AV nodal conduction velocity. Function of beta 2 receptor is relaxation, glycogenolysis, gluconeogenesis. Beta 3 receptor function is lipolysis. Here is the systemic representation of adrenergic neurotransmission. We can see tyrosine is converted into dopa, dopa is converted into dopamine, and dopamine is then releases the noradrenaline, which then binds to its receptors alpha and beta. Adrenergic drugs, these are classified into three types. Direct systematic, they act directly as agonists on alpha and beta adrenoreceptors. The drugs are adrenaline, noradrenaline, isoprenaline, phenylepinephrine. Indirect systematics, they act on adrenergic neuron to release noradrenaline, which then acts on the adrenoreceptors. The drugs are tyramine and amphetamine. Mixed action sympathomatics, these drugs are ephedrine, dopamine, mephentermine. The MCQ of these topics are: the first MCQ is both norepinephrine and epinephrine can be given IV to produce pressure responses. While both work equally well in many cases, what receptor subtype is stimulated by epinephrine but is not stimulated by norepinephrine? First option is alpha 1, alpha 2, beta 1, beta 2. The correct answer is beta 2, D. Second question, stimulation of beta 1 adrenergic receptors leads to decreased blood pressure, slow heart rate, fast heart rate, nothing. The correct answer is fast heart rate, C. Dobutamine causes increased cardiac output, increased in heart rate, increase in blood pressure, increase in peripheral resistance. The correct answer is increased cardiac output. Sympathomatics drugs causes decrease in heart rate. Adrenaline, isoprenaline, noradrenaline, none. The correct answer is C, noradrenaline. Fifth question, stimulation of beta 2 adrenergic receptor causes pain relief, hypoglycemia, bronchoconstriction, vasodilation. The correct answer is vasodilation. Thank you.